The third annual Hair Fair that took place today, October 14, 2021 at Edwin Lewis Community Center, Huntington, West Virginia, drew the attention of the local population to benefit from the free hair services and educational information that were provided by different vendors. The hair fair that was organized by the West Virginia Minority Hair under the theme Bridging the Gap Between Hair Disparity, especially in the underserved community, was a milestone towards that goal. Some of the services provided today were free COVID-19 testing and vaccine, including the influenza or the flu shot by Walgreens, while others were just there to provide information on how and where to get access to health care. The UNICEF Hair Plan of West Virginia representative was also present, and many other vendors.
Okay, we know that you represent Unicare Plan for West Virginia, and what is your goal here today?
So our goal here today is to educate the community about health conditions, how to prevent them, and also about how to maybe better manage them. We're here to kind of start that dialogue about, how we can maybe close some of the health disparity gaps in our communities, and we're here to provide resources. There's a lot of different health screenings going on today, and so we just want to be a part of that. So it's been a great time to participate at this third annual Minority Health Fair, as well as sponsor.
How are you ensuring that the information and all the resources that we have actually reach to the neighborhood, especially where the minority, the black community, the African American, they actually live?
Right. So Unicare, we're committed, we're engaged, we're excited, and we're invested. Today we provided the Marshall University Minority Health Institute with $1 million because we understand that we need partners to help us really address these social determinants of health in minority communities and vulnerable communities, as well as kind of bridge those gaps where needed.
My name is Lee Pennington, and I work with Donate Life in West Virginia and Kentucky. Very happy with the people that I've spoken with, and I've been able to get the message out about the importance of organ donation among minority populations, and that was my goal coming into the event, and I'm just very happy with what I was able to accomplish today.
I'm with Ebenezer Medical Outreach, and we try to offer free, affordable health care to the Fairfield community and surrounding areas. So we also have dental services and eye services as well, and pharmacy.
And where are you located exactly?
We are located in the Douglas Center, right across the street there.
Okay. Thank you so much. You say you are big brothers and big sisters. So can you explain to us again what that means to the public?
Yeah, so we are a mentoring agency. We cover the tri-state, and so we are here to draw awareness today to help the community too, and also to have big mentors volunteer for us, because we have several littles on our waiting list. And so you can find us in Huntington. We're on 5th Avenue, and also we have a Facebook page. That's probably the easiest. It's Big Brothers Big Sisters of the Tri-State on Facebook. I know everybody's on social media, so that'll be the best way probably. And all of our contact information is on there as well.
So what do you have here, or what are you doing here? Can you explain to us?
So we're with the Marshall Counseling Center. We have pamphlets, we have some essential oil kits just for relaxation stuff, and then some food bags as well.
We are mainly elderly focused company. A lot of our clients are elderly, so we tend to deal with those, and it just lets them keep their independence as long as possible in the home without having to leave their home and get a long-term assisted services through another agency.
What we have done with our limited resources in this first year is provide small community organization grants for capacity building, so that those organizations can take the limited funds that we had to their communities and make folks aware of what they have to offer, but also do an assessment of community needs. So community organizations assessing the needs of their own communities. We think that that's the formula.
Another way to make healthcare accessible to all is by getting students enrolled in some of the healthcare professional programs like the physical therapy.
My name is Scott Davis. I'm from the School of Physical Therapy. I serve as the chairperson. We're here today to talk about really three things. One is, what is physical therapy? Two is talk a little bit about physical therapy school and the education that's required. But one of the things we really want to get across today is that we offer a pro bono clinic where we provide free services for those individuals in the community who do not have any health care insurance. So that's what I really want to get out today, the message, and to share with other individuals that we do provide services for folks without insurance.
Physical therapy, talk about physical therapy. What exactly is it?
Physical therapy is currently a doctoral degree, and it is a profession that allows individuals to work with individuals with various disabilities, typically physical disabilities. It covers musculoskeletal, it covers neurologic, cardiopulmonary, pediatrics, geriatrics. So we treat patients from the cradle to the grave.
So you represent the School of Physical Therapy at Marshall University. What level, what entry level is it? If there are young folks outside here listening to you right now, what would be their criteria, or what criteria do they have to meet to get into the School of Physical Therapy?
In order to get into physical therapy school, you have to have a bachelor's degree in something. Many of our students come to us with an exercise science background or health sciences, athletic training. But honestly, any degree is fine as long as you have the prerequisites. Most of our students need to have biology, chemistry, physics, and psychology, as well as anatomy and physiology.
Thank you, sir. Thank you for your time today.
You're welcome.
Dr. Anthony, a professor and chair of public health at Marshall University, who was in charge of the overall event, gave an appraisal.
I understood that you are one of the main organizers,
right,
if not the sponsor.
Yes.
So what do you have to say to the public?
Well, I'm chair of the Department of Public Health, of course, and I'm the founder and director of the Minority Health Institute here at Marshall University. And today is one. Every year we have annual health fair for minority. We call it Minority Health Fair in West Virginia. It's the only one of its kind that is held every year here in West Virginia and in Marshall, Huntington. Today was a great day. Actually, this event is a culmination of an award that was given by Unicare Healthman of West Virginia, which is part of this program. And what we did here today was to engage in various activities, educating people about the need to live healthy living, the heart screening for COVID, HIV, AIDS, diabetes, and other infectious and chronic diseases.
So, sir, do you think the population coming out today was kind of moving towards the objective of what you initially thought, that you want to reach out to the minority community?
Right, right. Yeah, that's true. Exactly, that's true. Even though the minority community of West Virginia, particularly African American, is merely 3.6% of the total population, they continuously disproportionately bear the burden of health disparities, meaning that they are more likely to bear the diseases and live with the diseases and die with the diseases. And what Minority Health Institute does is to engage in research and health promotion and disease prevention to bridge the gap between the minority population and their white counterparts in West Virginia.
Okay, sir, thank you. It was a pleasure being with you.
Thank you very much. Thank you for having me.
Yeah, thanks. The health fair that we are witnessing out here today is being sponsored by Marshall University Minority Health Institute. The goal is to reach out to everyone who does not have health care, is to bridge the gap, bringing communities together, and that is exactly what we are witnessing here today. For Gaza Media, I'm Ernest Kumba.